Hi, my name is Cody Fremoire, and I'm doing my presentation on Patricks Swayze's pancreatic cancer and how endoscopic ultrasound is the best way to diagnose it. Patricks Swayze was a male actor, very popular in the 80s and early 90s in movies such as Ghost, Point Break, Roadhouse, Dirty Dancing, and etc. In March of 2008, Patrick Swayze was diagnosed with stage 4 pancreatic cancer, which had spread to his liver. And then of September 14th, 2009, he passed away from the cancer. He was only 57 years old. And while he had cancer, he actually became an advocate for pancreatic cancer, make it more well known to the public since it's known to be a silent killer. So what is pancreatic cancer? Well, first I'm going to talk about what the pancreas is. Basically, it's a gland right behind the stomach. It secretes digestive enzymes to help digest food, and then also produces insulin. What pancreatic cancer is when cells proliferate uncontrollably and it forms a tumor. Eventually it starts to spread, which it can spread to other organs, making it lethal. There's two different kinds of pancreatic cancers. There's exocrine, which has to do with the digestive juices, the most common type, and then there's endocrine, which is the least common type and has to do with the insulin. So 50,000 people a year will get pancreatic cancer. 3% of cancers will be pancreatic cancer, and then 7% of 7% of cancer deaths are from pancreatic cancer. So as far as the signs and symptoms, since the pancreas affects pigment, it's going to cause jaundice of the eyes and skin, meaning it's going to turn like a yellowish tint. It's also going to affect the color of the stool and urine. It's going to cause radiating abdominal pain to the back because the tumor gets big. It starts pressing on other organs and vessels. And also, as far as Patrick Swayze's signs and symptoms, he had similar symptoms. He had indigestion, like he felt like he was bloating, he felt like he was belching and burping a lot, and he also got sharp abdominal pains because he noticed when he drank a sip of wine, he felt this sharp shearing pain, and he knew he had to go to the doctor as soon as he found that out. He also lost a lot of weight, and he said he lost about 30 pounds within the first couple of months. And right here is when he had, this was later in his cancer stages, and he lost a ton of weight. So there's 4 different stages of pancreatic cancer. So I'm going to represent here, basically this is the pancreas here. These are the blood vessels, and this green stuff is the lymph nodes. So stage 1, it's the cancer is 2 centimeters or less, and it just stays right in the pancreas area. When it gets to stage 2 though, it starts to spread, and it starts to spread at nearby lymph nodes, but it's under 4 centimeters. By stage 3, it then starts to spread to blood vessels, and that's where it becomes dangerous because that's the route to different organs. And then when it's at stage 4, that's when it's really dangerous, and it starts spreading to different organs, for example, like the liver, and that's when it starts to become fatal. So as far as cause and risk, there's no known cause today for pancreatic cancer, but there is certain risk factors that raise the risk, like hereditary genes. If someone in your family has pancreatic cancer, or if they just have cancer alone, diabetes, of course, because malfunctioning of the pancreas. Pancreatitis, that means there's inflammation, and then drinking alcohol, that doesn't necessarily cause cancer, but it does cause the inflammation, and especially smoking. Patrick Swayze actually blamed himself for when he got it because he smoked most of his life. So as far as prevention goes, just make sure you quit cigarettes, limit alcohol consumption, eat a healthy diet, exercise regularly. One thing they were able to do to find it early is to do genetic testing to see if it's a trait that you may have. And if they do find out you have that trait, then they'll do further testing like endoscopic ultrasound. So there's different ways to diagnose pancreatic cancer. They can do blood tests, see if your blood's abnormal. They could do different imaging modalities like CT, MRI, or PET scan. If it does come out positive in those, then they'll do a further study to get a more descriptive image like endoscopic ultrasound, which I'll explain in the next slide why it's the most important way to diagnose. So as far as endoscopic ultrasound, I'm going to show you here is where the stomach is. And basically what they do is they get this long flexible tube and they place it in the esophagus here, and it goes all the way down to the stomach, into the duodenum. And as you can see, the pancreas is right behind the stomach here. And what it does is at the end, it has a camera, and it says sonographic waves. That way it gets the ultrasound picture. and they're able to get the most optical images. They're also able to put a needle, like just different tools at the end of it, like a needle to aspirate tissue fluid to send it to a lab. That way they could test if it's cancerous or what stage it is. As far as prepping for the endoscopic ultrasound, just make sure you stop taking blood thinners, fast 6 hours beforehand. They'll give you sedatives, help you relax. They'll monitor your vitals through the whole procedure, make sure everything's stable. They'll have a nasal cannula, have you biting on a block so you don't hurt yourself. The procedure only lasts less than an hour, kind of like a colonoscopy. It's in an outpatient center. And the recovery, will have you wait in a recovery area for about an hour. It takes about an hour for it to wear off. But just make sure you call for a ride before you're all done with it, because you're not going to be able to drive home yourself. As far as the benefits with endoscopic ultrasound, there's no radiation, so no exposure, no contrast, no claustrophobia like MRI, and there is you get the best optical images. For example, right here's a picture of the endoscopic ultrasound, and they have right here you have the pancreas. Right here, this little thing is the needle aspirating the fluid. The risk, what they like about this is the risk is less than 1%. It's very minimal risk, and the risk that there is bleeding, inflammation, and infection. As far as treatment goes, if you're diagnosed with pancreatic cancer, they'll do surgery to remove the cancer along with part of the pancreas. If you're diagnosed at stage 4, then it's too late to do surgery, and they'll just do chemo and radiation therapy for palliative treatment to relieve your symptoms, help prolong your life a little bit longer. Another thing they'll do is clinical trial testing. Only 5% of patients will do this, and it's just experimental drugs. As far as Patrick Swayze's treatment goes, he did the chemo and radiation therapy because he couldn't do the surgery. He was diagnosed at stage 4. And he did also the clinical trial, which he did with immunotherapy, which stops the blood supply to the cancer. So as far as prognosis goes, average person to survive with diagnosed pancreatic cancer is 3 to 3.5 years. If they're diagnosed at stage 4, then it's only a year. With Patrick Swayze, since he did the radiation and chemotherapy along with the clinical trial drug testing, it actually worked in his favor, and he did survive in 20 months after being diagnosed. So this is the end of my presentation, but not the end of the legacy. May you rest in peace, Patrick Swayze.